Thank you. Dr. Murthy, thank you so much for being here. I want to thank the committee for holding this. I want to associate my comments with, my position with some of the comments made with my colleagues around the telehealth, how important it is, with Senator Bennett's comments earlier. Let me just say this. I think it is so important in this day and age that there is mental health parity with physical health. There's too much of a stigma around mental health. But nobody has a stigma about concerned about their physical health and getting the health care they need. And there's resources, there's sources for funding, there's some professional care that's there, but we don't have that for mental health. And so, Dr. Murthy, I want to talk to you about this because I see it in my state, Nevada. We knew we were having mental health challenges even before the pandemic, particularly for our kids and young adults. The pandemic has exacerbated that. And we have to do more to provide essential services to them, the continuum of care of services, the funding sources to get those services and access, and then build up the professional capacity that's needed to provide those services. But let me ask you this. I so appreciate you putting out the Surgeon General's advisory. I think it is, thank you so much. It's a great educational piece for so many communities to really tackle. But here's my question for you is, how do you plan to get the word out? How do you plan on getting the advisory out in the hands of the people that need it so that we can start incorporating some of the recommendations that are in it?
Well, Senator, it's good to see you again, and I'm glad that you asked that question because one of the things that I decided early on when I was Surgeon General during my first tour of duty was that we can't just produce reports that sit on a shelf. We've got to make sure that they are brought to life. And the people who bring them to life are community members who take the information, take the tools, and then create change in their communities, legislators as well. There are several approaches we're taking. We've been working already from the launch of our advisory with community partners, with parent groups, with other community organizations, including faith organizations, and others to make sure, and educators are a key part of this as well, that people know about this advisory, they know about what the recommendations are in this advisory, and that we can help support them, whether that's connecting them to resources in the federal government or whether it's connecting them to other community resources. But that is what we are trying to do. I am also aware, and I say this, just with humility, that none of us can do this job alone. And I know that as much as our office is going to try to do, we need the help of legislators like you and others to help get the word out, to help people recognize that, you know what, these recommendations can be acted upon. There are laws that can be passed to strengthen access to care. There are measures that communities can take to make sure that kids are supported who need it. There are things educators can do to make sure that we're including a greater focus on behavioral health and on emotional learning in schools. So we're going to keep working at this, Senator, because the job's not done when the report comes out. We've got a long way to go.
I can't agree more. And so let me add another area of coordination that is important. In your testimony, you urge coordination across all levels of government. And I strongly agree with that. I think there is a partnership at the federal level that needs to occur. Too often there are silos, particularly in this space. And that's why I sent a letter to both the Secretaries of Education and HHS. This is such an important issue. So can you talk a little bit about that? And I hope that coordination that you've just talked about, getting your advisory out there, includes the coordination with our federal agencies.
Absolutely. And this is so important. Secretary Becerra from HHS, has asked for the Behavioral Health Coordinating Council to be formed. It has now formed. It is bringing together parts of the federal government to work on a unified approach to behavioral health. I will say I myself personally have worked with and been working with Secretary Cardona from the Department of Education. We have a shared passion and interest in mental health. Department of Ed, as you know, has put out resources for students and for schools to focus on social and emotional well-being and on mental health. And that's a partnership that we're going to continue as well. But you're absolutely right. This has to be a collaborative effort. We can't afford to be splintered and uncoordinated.
And then very quickly, I've seen the benefit and the value of peer support services. Yeah. Can you talk about the importance of peer support services?
These are really vital. One of the programs that I came to learn about some years ago is the Beyond Differences program. It's not a government program. It's a program that was started by two parents who lost their child, and they were devastated at the struggles she had with loneliness. and with her own mental health. And this is essentially a peer program, a peer support program, where young people help other young people to build community and connection and to build their self-esteem. When we think about the healthcare workforce, I actually think we have to think broadly. This includes psychiatrists and psychologists and school counselors, but it also involves people who can be sources of support, educators, peer support programs. Everyone has a role they can play in helping to support the mental health and well-being of others. And this is where we also, I think, have to empower families to also see that when they even begin conversations with their children on mental health and well-being, that's also a very important part of the puzzle. It tells kids that it's okay to talk about these subjects and to ask for help.
Thank you, Doctor.